started. All
All
right,
right.
guys. It's Sarah at carnivore.yogi on Instagram. And today I'm really excited to have Nathan here with me. He's known as Carnivore Nurse on Instagram. He has a great story, and I think it's going to be of value to you guys. So let's just jump right in there. Nathan, tell everybody about you. What's going on?
Okay. All
Yeah.
right. Well, yeah, so I'm the Carnivore Nurse on Instagram, and I am actually a nurse. So currently I work in the ED as an RN. I have a really interesting story for like what brought me to this carnivore journey. And honestly, most of it just has to do with the traditional keto diet. So I'll go in depth with that and explain. But I have a really interesting history with medical issues, and it took me probably about 4 years to really understand what was going on with me. I went through a lot of doctors. I went completely down that path of traditional medicine, and it failed me, as it does most people. And so then I made the turn to holistic medicine, and that's really where my healing began, because for years I was just on a list of pharmaceuticals, and I was not getting any better. Doctors weren't giving me answers. Everyone I talked to in the traditional medical community was just telling me, take your medication and stop digging for answers. That's essentially what was happening. So needless to say, I'm very passionate about all of this. I know that it completely changed my life. And, I do believe that people can empower themselves and change their health. And they just have to basically realize that the end all is not a pharmaceutical agent. Like, you can empower yourself and change your health for the better. And that's really what drives me to raise awareness about eating, nutrition, and all of this. So do you want me just to hop right in with my story
Yeah,
now?
tell us a little bit about some of the health issues you were having. And I feel
Mm-hmm.
like this whole conversation is just kind of so fascinating, just because you are in just regular medical profession. You're kind of on the front lines of
Yeah.
all of this stuff with your job. So yeah. Um,
Right.
yeah, let's.
Okay. So I guess I'll go back to around 2014. It's kind of interesting. I started having just basic issues concentrating. So I didn't think much about it. I started having a lot of brain fog, and I basically was kind of presenting as if I had symptoms of ADD or a list of other psychiatric issues. I was having like panic attacks. I was suffering with depression. I would have random headaches all the time, and like I just felt bad like all the time. My eyes would be super dark constantly, so everyone would come up to me and ask me like, "Are you sleeping?" And like I would be. So yeah, that was around 2014, and it got to where I was just living on caffeine because I could not think. Like, my brain fog was so thick, I didn't even know what to do about it. So around the end of 2014, I went to a doctor about all of this, because I've never been big about going to doctors with problems. That's just, I don't know. I've just always been like that. I went to a doctor. It was my PCP. He immediately referred me to a psychiatrist, because that's just what you do when you have something going on in the brain and it's not understood. You throw it into psychiatry because that's a catch-all. I mean, no disrespect, but it is what happens. And so I got thrown into the field of psychiatry for probably at least a year and a half, maybe 2 years. And they treated me that whole time as if I just had ADD or a mood disorder or a list of other things. And I will take this time right now to say that, like, I had never struggled with those things in the past. So prior to 2014, I started dealing with all these cognitive issues, concentration problems, headaches, mood and anxiety issues, and that was all new to me. So that's why the whole time I really doubted that it was anything truly in the field of psychiatry that was the root cause of what was happening to me. But nonetheless, we're all taught to trust the system, trust traditional medicine. They're the doctors. They went to school, So anyways, I got put on high doses of Vyvanse, Adderall, Wellbutrin, Lamictal. I mean, literally, I could list off 20 medications, and every day I would wake up in just such a fog that I really couldn't even function properly. Probably around the time of 2016, I discovered the keto diet. And I discovered it on my own while I was still seeking care from traditional doctors. So I was still taking all their pharmaceuticals. But I learned that as I went low carb, my brain fog cleared up. My mood issues were greatly resolved. My headaches went away. My sleep improved. So I kind of took mental note of that, but I still was seeking treatment from traditional doctors. But I thought in the back of my mind, you know, something's going on here with my food. I just don't know exactly what's happening. So at that time, I ended up getting on the waiting list for Mayo Clinic, which is a pretty big deal because they don't accept just any patient. So I went to Minnesota. I was there for almost 2 weeks. They did tons of testing. I met with the top neurologist. I met with a few psychiatrists, and I explained to them what was happening. And I should also say that, like, this got so bad that I would, like, almost slur some of my words, and I would forget people's names that were like family. I mean, people very close to me, I would just blank on the name. And so that got to be pretty scary. I was really having some cognitive issues. And I've always been pretty much a straight A student. So this was just not normal. Something was going on. But anyway, so fast forward to when I was actually able to go to the Mayo Clinic. I explained all this to them. We did all this testing, and I left after 2 weeks with no answers. So, you know, obviously when I left Mayo Clinic, that's like the top tier of traditional medicine in the US. So I had put all my eggs in that basket thinking they're going to give me an answer on what's happening here. And so I don't have to worry about all of this stuff anymore. They're going to give me closure. I left there with no closure. And I felt honestly the most hopeless that I've ever felt in my life, because I had no idea how I was ever going to come through any of this stuff, you know, if Mayo Clinic couldn't give me an answer. So on the car ride back, it was a 10-hour drive. I remember thinking, I'm not settling for this. And I then basically got on the waiting list for Cleveland Clinic Center for Functional Medicine. So, yeah, I just changed my whole mindset. I thought, well, if traditional medicine can't give me answers, I'm going the holistic route. And at that point, I was just waiting for my appointment at the functional center at Cleveland Clinic. That changed my whole life. Like, honestly, now I have views that are a little bit different than that functional center, but it completely changed everything. So I'm so thankful and grateful for the physicians that I met there. When I got to Cleveland Clinic, basically, I explained my cognitive issues to them. I explained that the diet made a difference in my symptoms. And I think at that point too, I was kind of experimenting with some fasting. So I told them, you know, when I fast, my brain fog gets better and all this and that. So we went through a series of tests, and they look at the body just so differently. I mean, they analyze your stool. They're looking at blood tests that traditional docs wouldn't even consider taking. It took a couple months and a few consecutive visits at Cleveland Clinic, but finally we found that I had a severe mold infection. And I don't know where I picked that up or when I got it, but what's crazy is that as soon as we started treating that, I started getting better. And so it was just like a breath of fresh air, because finally I felt like I had closure in my health issues. So basically what treatment consisted of was about 6 months of, it's a pharmaceutical, it's called cholestyramine, and it's generally used for like high cholesterol, but it's not even commonly used for that. But it's a powder, you mix it up. And what I learned was that a lot of these functional doctors use it kind of off label for binding mold toxins in the gut. So it binds them, and then, you know, you poop them out. So I did that for about 6 months, but I also stuck strictly to my ketogenic diet. I mean, I had a blood ketone meter. I was like, I never cheated, because if I cheated, I couldn't think. And I felt like I was panicking, and I had all those neuro issues come back full force. So there was no such thing as a cheat day back then. It wasn't worth it to me. I had to think, and I had to function, and I had to work. But yeah, essentially, mold had been causing all my problems and had been causing the neuroinflammation, which
Mm.
makes sense because the gut is so completely connected to the brain.
Mm.
But as I started getting those mold toxins out of me and I stayed low carb, implemented fasting, the mold was dying off gradually, and I was getting that out of my system. And now, I'm completely medication free, and there's not even like a glimpse or touch of any of those issues I used to deal with. Like, they're completely gone. So, um, part of me wants to go back to Mayo Clinic and tell all of these top physicians and neurologists that y'all missed it completely. I'm completely fine. And they want to just keep me on pharmaceuticals long term, because it blows my mind. It blows my mind that this is our healthcare system, and I fell through the cracks. And so really, I'm very passionate about finding those people that are falling through the cracks, because I just really believe in digging and finding root causes of issues, and because that's what happened to me. So, but just to add, because there's so much detail to this story, just to add a few little pieces of this, when I was stuck in traditional medicine, I followed all of the recommendations, and ultimately when the pharmaceuticals weren't working, I went through and had a procedure called TMS therapy.
Oh, the
Yeah.
magnetic. Yeah, I've heard of
Yes.
that.
And
Yeah.
like, honestly, again, I viewed that as like the answer. I thought, okay. And it was so much money. When I look back on this, I'm just disgusted, because I spent so much money looking for answers. And I'm so thankful I finally have closure.
Yeah.
But I have so much experience through traditional medicine that, like, I literally understand so much of it. I went through it, but yeah, I went through the TMS treatment, which, by the way, I think that's a really cool treatment for
Yeah.
people that are dealing with genuine depression and anxiety. I think it could be really
Yeah.
beneficial. It's drug free and it's pretty long lasting, but it didn't fix my issues, because my issue was mold related and it wasn't originating in the brain, essentially. So, it didn't fix my issue. But yeah, that's kind of the basis of my story. So I became very passionate about low carb eating and ketogenic eating, because it essentially pulled me through my health crisis. When I would eat those carbs, it wasn't like, oh, I'm going to feel kind of tired after I eat these carbs. No, like, I literally felt like I was panicking. I felt severe brain fog. I felt like I could not even function, because those carbs for me were feeding that mold infection. And so that was just spreading inflammation through my body, including my brain. So, I really nerded out on keto. I mean, I went all in, I think the first so essentially, I would go to all these traditional doctors and tell them that my ketogenic diet was helping. Like, I didn't know what was going on still, but I told them my ketogenic diet is really improving my symptoms. All of my traditional doctors dismissed it, every single one of them. And it blows my mind, because, when I went to Mayo Clinic and told them that my diet was affecting things, it just over their head. These are the top professionals in traditional medicine, and it didn't even register to them that diet was impacting my cognitive function.
Mm-hmm.
So
It's
I
so
could talk about this for days.
astounding to me, and I feel that as well, having a daughter with severe autism. For years we were told, oh, diet doesn't matter. But I was like, when she was first diagnosed, I was like, nope, she's off of dairy, she's off gluten, she's off
Yeah.
soy. Like, we're done with all of that,
Yeah.
But I've still even run into doctors and people who are like, diet doesn't matter. And I'm like, absolutely, that is a bunch of crap,
Yeah.
Yeah. Yeah.
And honestly, I have learned that if I'm talking to someone that's completely closed off to hearing this, whether it's just an individual or a medical professional, I stop, because it's not worth it. It drains me. Like, I want to share this message with people who want to listen, but
Yeah.
if someone wants to rely on the traditional system for their problems and they don't care about healing, fine. Like, everyone needs to live their life, but I really believe in healing. And I think that from most things, our body wants to heal. And, it could make me bitter looking back on these doctors and what they told me. And because honestly, a lot of them thought I was crazy. They just told me to stop looking for answers, but I couldn't. I'm the person that I always have to have closure in my life. And this was such a huge problem and dilemma. You know, it kept me out of school for a while. It was just crazy. It was a crazy journey. I'm so thankful I'm through it. But yeah, so the low carb eating, that's how I became passionate about it. And before then, this is important to know, I was eating just the standard American diet. Like I had no restrictions on anything, and I just believed the food pyramid was complete truth, even though I didn't even follow that. But I'm just saying, like, I believed, oh, dietitians traditionally trained know everything, which now it's all completely wrong. I mean, so, but yeah. And so even when I started coming through my mold illness, I made the decision to stay ketogenic for the rest of my life. And that sounds dramatic, but like I felt so good being ketogenic that I knew I would always follow that kind of lifestyle.
Yeah.
So it was around March of last year, or no. Yeah, this is 2020. So yeah, March of 2019, when I started transitioning more into the carnivore style of eating. And it was a natural progression for me. And I've kind of heard that from a lot of people that are carnivore now, like going from keto to carnivore. But for me, I was keto, but I still had to watch out for some of the keto foods that I was eating. The high histamine foods were like really affecting my cognitive function. And so I think it all has to do with gut health and the permeability of the gut lining. So from that infection, my gut was such a wreck. You know, if I ate avocados, I would like get brain fog, and I would feel like kind of anxious. And then if I ate salads with like vinegar, like balsamic vinegar dressing, the vinegar would trigger my symptoms. But it confused me for like maybe 5 months, because I was like, well, I'm keto, but I'm still having flares. So I started logging my food, and I noticed that high histamine foods, even in the keto diet, were triggering some of my old symptoms. And so it was natural for me, as I started cutting foods out of my keto regimen, it was just easier to eat mostly animal protein, you know, fatty animal protein, and just leave it at that. So that's what happened. Like finally, instead of just cutting all these random foods out, I think I came across maybe Michaela Peterson, or I don't even know who it was first that I saw. Maybe it was Dr. Saladino, but either way, I thought they were absolutely crazy. Like, I'll be honest, thought it's so crazy. Someone just eating meat. Like, how are you going to get your vitamins and nutrients? What about fiber? What about pooping? You know, crazy stuff. But for me, you know, since I already restricted my diet like that, it made more sense for me just to go fully carnivore, which is what I did around last March. And I've noticed a lot of really cool improvements since doing that. But that's what kind of made me go more into carnivore versus traditional keto.
Those histamine reactions that you were having.
Yeah, and it was pretty severe for a while. Like eating carbs triggered my symptoms, but then when I went keto, honestly, some of those histamine reactions were just as bad as me eating carbs.
Yeah.
So I started learning that like all of that's related to gut health. And as your gut lining improves, the histamine reactions improve. So, you know, now like I could eat an avocado and it wouldn't bother me, or I could have balsamic vinegar on a salad and it wouldn't bother me. Whereas 2 years ago, it would have very much so. So that's cool that you can see your body heal. It just takes time. Like healing does take time.
It does. It does.
Yeah. So, but I guess, you know, as far as like the carnivore side of this, honestly, two things really stand out to me. Digestive health, like I have no gut discomfort eating this way. And, you know, when I was keto, I would still have some stomach pain randomly, or a little bit of bloating, or, you know, whatever it is. Like my stomach is just very sensitive. It always has been.
Same.
So going carnivore, like zero bloating, zero gas. Like gas is not normal. Like I'm learning.
No.
That's so crazy.
I
like
never knew that either.
You're supposed to burp and you're supposed to have gas. Like, okay, I don't do either of those now, and I feel great. But also, I will say this, I think in the traditional keto world, they preach protein restriction too much. Like I was under eating protein for at least a solid year on keto, but I didn't know it. Like, you know, I thought, well, this is just normal. for a ketogenic diet, this is how you're supposed to feel. But at one point, I was ripping muscles in the gym. Like I train with weights. So as far as cardio, maybe I wouldn't have noticed it as much. But I definitely can look back and say I was in a protein deficit for most of my traditional keto journey, which I hate that now, but now I know it. But now it's crazy because like my schedule is just way more hectic now than it was 2 years ago. So when I go to the gym, people are coming up to me asking me like, man, you just in here more? Like, what are you doing different? What supplements you taking? But honestly, it is what I think. It's the high protein of the carnivore diet combined with the fact that you're just not spiking your insulin very much.
Mm-hmm.
So you're staying lean. I'm working out less now in the gym, but I look way better than I did 2 years ago. And I attribute that mainly, keto, but even further carnivore. It's keeping me lean, like it really is. And cravings are next to nothing, but also just that protein. I mean, animal protein is so important. And I was under eating animal protein for a long time. So that's really cool in my opinion. Mental clarity has improved even more too, as I've removed foods to get to the carnivore place. So some really, really cool benefits.
Very cool. It's such a cool story. And, now that you're working as a nurse and you're kind of in the middle of all this, how does that affect the way that you do your job?
Well,
it's a loaded question, I know.
Yeah. Well, and to be honest, I'm sort of new at nursing. So this is a second degree for me. So I just graduated in December, but so far from what I've seen, and I expected this, and I'll just say this first too. My long-term goal here is to get my nurse practitioner degree and open a clinic at some point and treat people through holistic interventions. So I came into this knowing that my time as being an RN on the floor would be internally stressful for me because I would see a lot of things that I didn't agree with. But I went into it knowing that would be the case. So I think it's important that like I knew that from the beginning, and I saw this as a stepping stone to my next place that I wanted to be. Just from the people that I have kind of briefly told, I just eat meat. It doesn't go over well. Everyone's like deeply concerned about me. They think that like I'm going to die tomorrow of a heart attack, or they think, oh my gosh, you probably haven't pooped in a month. Honestly, I'm still learning how to balance all of that. I go into work and I try to do the best that I can to care for patients. And if the conversation comes up, I definitely share it with them. I think the biggest message here is like not keto, not carnivore, but just like self-empowerment. And I think if once people, patients, whoever realize that they actually can empower themselves and empower themselves in a health sense, like that means a lot. Forever I thought that, I don't have any power on my own to come through this. Like I just have to trust the system. But once I realized like, oh, actually I can do things to change my health. So that's the biggest message I want to relay to patients at this point. And when I see that someone's open to things that are a little out there, like carnivore, what we do, I would definitely share that with them. But it is tough. It is frustrating. But I have to keep the long-term goal in mind and know that at some point as a nurse practitioner, I'll be able to make a bigger impact in this way in patients' lives. So, yeah.
Absolutely. Well, I commend you for going out there and helping people. And it's just such a great story. And I think so many people can learn so much from your story, especially just your spirit to just persevere, even when you were on all these medications and trying all these treatments. And I've kind of done that with my daughter and like, oh, this is going to be the thing, or hyperbaric chamber is going to be the thing that's going to change it. And like, we just sink all this money and time and stuff into it. And you kind of go on this emotional roller coaster, but you really have persevered through that. And it's amazing. And now trying to flip it and start helping other people. So I just love it.
Well, and I do want to emphasize this too for whoever's going to watch this, but like, healing takes time. Like, you know, in the middle of all this, I was making small improvements, but in the back of my mind, I was thinking, this is never going to end. Like, I will never get through this. But now, like, I'm completely medication free. I have no symptoms of any of that stuff. But I look back, and it was like a multi-year process. So I guess just be patient with yourself, trust the process, and know that other people have come through things that they thought they would never come through. That's the big thing I want people to understand.
Yeah.
So, yeah.
I love it. And people can find you on Instagram. It's Carnivore Nurse.
It's at the Carnivore Nurse.
Okay, cool. I'm going to link it below the video also.
Okay, sounds good. And you know, at some point in the future, I'll probably start a YouTube channel. But yeah, right now it's just Instagram.
Yeah.
Yeah, I don't know.
I just want to.
I want my story to help people. So whatever platform I need to be on to help people. But yeah, right now it's on Instagram at the Carnivore Nurse.
Cool.
So yeah.
Yeah, I would love to help you start your YouTube. I think so many people can benefit from hearing your story, and it's just, like I said, just a spirit of persevering, and now that you've figured some things out, really wanting that spirit to help other people as well. So
yeah, well, I appreciate that. Yeah, for sure. So
cool. You guys just stay tuned and follow him on Instagram. We'll stay tuned to see what's next.
I appreciate it. Thank you so much for having me on.
Thank you for coming on.
Yeah.
All righty.